Hello everyone, now let us discuss about CPT coding guidelines for surgery, integumentary system, part 2B. In this we will be discussing about the repair and reconstruction of breast. So in part 2A we have covered the breast biopsy procedures, percutaneous image guided placement of breast localization devices, mastectomy procedures, and in the current session, that is part 2B, we will be focusing on repair and reconstruction. So coming to repair and reconstruction. The breast reconstruction is performed to repair defects due to congenital anomaly or loss of breast tissue after surgical excision. The goal of breast reconstruction is to correct anatomical defect and to restore form and breast symmetry. A breast can be reconstructed using a single or combination of techniques, and breast may be reconstructed at the same time but may use different techniques. It may require more than one planned procedure or may require revisions. The native breast may be altered using different techniques. The breast and breast mount can be lifted with mastopexy. It can be lifted with mastopexy, which is given by the code 19316. Mastopexy is nothing but surgical procedure of elevating the breast tissue to a higher position on the chest wall. Pexy means union or fixation. So mastopexy means fixation of breast, or it can be reduced in volume with breast reduction, which is given by the code 19318, or it is augmented with a breast implant, which is given by the code 19325. Post mastectomy, implant based reconstruction involves placement of a device filled with fluid, for example saline silicone gel, to provide volume to the breast. In immediate reconstruction, an implant is primarily placed at the time of mastopexy, which is given by the code 19340. In delayed reconstruction, an implant is placed at the date separate from the mastopexy, which is given by the code 19342, which includes placement of new implant or replacement of the existing implant in mastectomy, defect or reconstructed breast. The removal of intact breast implant for replacement is also included in 19342 and it need not be coded separately. A breast implant cannot always be placed due to lack of adequate skin envelope. The code 19357, CPT code 19357 describes insertion of tissue expander, which is a device that is surgically implanted to create adequate sized pocket for insertion of the permanent implant. The tissue expander is an inflatable device placed beneath the skin and the chest muscle in which saline is injected over a period of weeks to create an implant pocket. The tissue expander is eventually removed or replaced with permanent breast implant, which is given by the code 11970. Removal of tissue expander. The placement of either a breast implant or a tissue expander may be reported separately when performed with flap reconstruction procedures. The code 11970 describes removal of tissue expander with concurrent insertion of permanent breast implant. Code 11970 describes the removal of tissue expander with concurrent insertion of permanent breast implant. The code 11970 also includes the removal of expander, minor revisions to the breast capsule and placement of new breast implant. Whereas code 19370 may be performed in addition to 11970 if more extensive capsular revision is performed. Usually 11970 includes minor revisions to the breast capsule, but code 19370 may be performed in addition to 11970 if more extensive capsular revision is performed. The code 11971 describes the removal of expander without the replacement of an expander or implant. Now coming to flap reconstruction. Autologous breast reconstruction involves harvesting a flap of skin or subcutaneous fat or muscle from one area of the body and relocating the tissue to anterior chest to create a new breast mount. The flap reconstruction can be performed at the time of mastectomy or in delayed fashion depending upon the patient preference and other oncological treatments. The code 19361 describes breast reconstruction with flap composed of latissimus dorsi, including some of the overlying skin and subcutaneous fat to reconstruct the breast mound. This type of flap is left on its vascular pedicel and tunneled beneath the armpit skin to the anterior chest to rebuild the breast. The blood supply to this flap is left attached to its origin in the axilla. To give the breast mount additional volume, a tissue expander or permanent implant may be placed beneath the latissimus flap. The placement of either a breast implant or expander may be reported separately whenever performed, along with flap reconstruction. And the code 19364 describes a microsurgical free tissue transfer of skin, subcutaneous fat or muscle for breast reconstruction. And this code includes the flap harvest, microsurgical anastomosis of one artery and two veins with use of operating microscope, flap inset as a breast mold and donor site closure. Typically, free flaps include free transfer rectus abdominis myocutaneous FTRAMS FTRAM or deep inferior epigastric perforator DIEP or superficial inferior epigastric artery SIEA or gluteal artery perforator flaps GAP. The code 19367 describes single pedicule transverse rectus abdominis myocutaneous TRAM, transverse rectus abdominis myocutaneous, in which subcutaneous fat and large portion of the rectus abdominis muscle from the lower abdomen is moved beneath the upper abdomen wall skin up to the chest to rebuild the breast. In TRAM, which is described by the code 19367, subcutaneous fat and large portion of the rectus abdominis muscle from the lower abdomen is moved beneath the upper abdominal wall skin up to the chest to rebuild the breast. And the blood site of the flap is left attached to its origin in abdomen. Whereas code 19368 describes supercharging of single pedicule TRAM flap, and this is typically performed to increase the blood flow in TRAM flap with marginal circulation to ensure flap survival. In addition to the standard unipedicule TRAM procedure, inferior epigastric artery and or veins are also anastomosed to recipient vessels in the chest using microsurgical techniques. The code 19369 describes a bipediculed tramp TRAM flap in which skin, subcutaneous fat and both rectus muscles are harvested for reconstruction of single breast. The dual blood supply to the flap is attached to its origins in the abdomen. Second and ancillary reconstruction procedures include nipple reconstruction, which is given by the code 19350, or implant adjustment through revisions to the breast capsule, which is given by 19370, or removal of the complete breast capsule via a complete capsulectomy, which is given by the code 19371 to achieve correct breast tissue positioning. In addition, procedures may be performed on the contralateral breast to create symmetry, which are given by 19, 316, 318 and 325. Removal of an intact breast implant without replacement is reported with 19328. And removal of ruptured breast implant, including the implant contents, is reported with 19330. A complete capsulectomy, which is given by 19371, includes the removal of breast implant and all intracapsular contents. Code 19380. It describes the revision of reconstructed breast. It includes significant excision of tissue, readvancement or reinsert of flaps. For autologous reconstruction, whenever autologous reconstruction is done, the code 19380 includes revision of flap position on the chest wall, removal of portion of the flap, that is via direct excision or liposuction, reshaping of the flap or scar revisions, and for placement of new implant or autologous fat grafting for increased volume, they may be reported separately. So whenever autologous reconstruction is done for the placement of new implant or for autologous fat grafting, these procedures can be reported separately. If any limited procedure is performed with a defined code, for example scar revision, then more specific code should be used. And for implant based reconstruction, 19380 includes revision to the skin and capsule when performed together. So these are some of the guidelines for 19380. The exchange for a new or different size, shape or type of implant or autologous fat grafting for increased volume, contour irregularities, they may be reported separately. That is same point, exchange of different size, shape of type or implant, or whenever we use autologous fat grafting for increased volume or to contour irregularities, these procedures may be reported separately. Whereas nipple reconstruction is reported with 19350 and it includes local flaps, alveolar skin grafting and subsequent tattooing. The code 19396 describes the formation of monolac cast of patient's chest defect, and this mold is used to fabricate a specific costume made implant that fits in the patient's defect. Now coming to the CPTs of breast alteration techniques. The first one is 19316, which includes mastopexy. Masto is nothing but fixation of breast. The next is 19318, breast reduction. The next is 19325, breast augmentation with implant. The next is 19328, removal of intact breast implant. 19328 indicates removal of intact breast implant. The next CPT is 19330, removal of ruptured breast implant including implant contents. The next is 19340, insertion of breast implant on same day of mastectomy. The next is 19342, insertion or replacement of breast implant on separate day of mastectomy. The next is 19350, nipple or alveolar reconstruction. Now let us discuss an example. A patient is 34-year-old female with approximately 15 to 16 years ago had left breast implant placed for breast reconstruction for her congenital deformity of left breast. This implant ruptured and in late September 2008, I performed a capsulectomy and exchanged her ruptured implant for a new implant. About a week after surgery, the implant developed an infection. Due to the infection, her implant had been removed. The patient's infection has been completely resolved and she is now ready to have her implant replaced. In the preoperative holding area, I marked her for the ideal position of this implant and performed a breast exam not showing a mass in either breast or no mass in axilla, and we proceeded. We did discuss with the patient, even though her original implant was in subplant position, I felt it would be beneficial to place the implant behind her pectoralis major muscle in the submuscular position today. And the patient agreed and we proceeded. This is the procedure. Patient is 34-year-old female. She presents for breast implant, placement of breast implant. So the appropriate code is, and the breast implant is to be placed in the left breast. So the appropriate code is 19342 with LT modifier. LT modifier indicates the laterality left side. So 19342 is the appropriate code, which is nothing but insertion or replacement of breast implant on separate day from mastectomy. Coming to next CPT, that is 19355, that is nothing but correction of inverted nipples. The next is 19357, tissue expander placement in breast reconstruction including subsequent expansion. The next is 19361, which includes breast reconstruction with latissimus dorsi flap. The next is 19364, which includes breast reconstruction with free flap. Examples are FTRAM, DIEP, SIEA, GAP flap. The next CPT is 19367, which involves or includes breast reconstruction with single pedicule transverse rectus abdominis muscle flap. Single pedicule TRAM flap. The next is 19368, which involves breast reconstruction with single pedicule transverse abdominis TRMA flap requiring separate microvascular anastomosis. The next is 19369, which involves bipediculed transverse rectus abdominis myocutaneous flap. The next is 19370, revision of peri-implant capsule breast including capsulotomy, capsular orrhaphy and or partial capsulectomy. The next code is 19371, peri-implant capsulectomy breast complete including removal of all intracapsular contents. The next is 19380, revision of reconstructed breast. The next is 19396, preparation of moulage for custom breast implant. Now the next is unlisted procedure 19499, unlisted procedure breast. Let us see one more example. Meredith has breast cancer on the left side, diagnosed by excisional biopsy performed last week. Today is having a radical mastectomy urban type and concurrently a single pedicel TRAM flap reconstruction along with supercharging. What CPT codes are to be reported? The first CPT is 19368 along with LT modifier to include the laterality of left side. So 19368 involves breast reconstruction with single pedicule transverse rectus abdominis myocutaneous flap requiring separate microvascular anastomosis, that is nothing but supercharging. The next is 19306 along with 51 modifier and LT modifier, which involves mastectomy radical including pectoral muscles, axillary and internal mammary lymph nodes, urban type operation. The 51 modifier is appended to indicate multiple procedures. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.